Welcome to the podcast. I'm your host, Jim Jorgensen, and today I'm joined by Visante's CEO, Steve Rao, and Visante President Phil Brummond to talk about Visante's annual top 10 issues facing pharmacies. Welcome, guys.
Thanks, Jim.
Thanks, Jim.
The top 10 is always a fun session. To start, give us a little background on the top 10. What is it? How do you come up with it? And how do you see it used in the market?
Yeah, thanks, Jim. Our goal for the top 10 has always been to help healthcare pharmacy leaders thrive in the future year and in the future years ahead. We have an ever-changing industry, and the top 10 for 2025 is no different, helping leaders get ahead and be successful. It's about giving back and helping pharmacy leaders thrive in the future, simply put. We partner with over 150 hospitals and health systems annually to help them drive financial and operational performance and improvement and value through pharmacy. And in that work, we see a lot of pharmacy leaders facing a lot of challenges, and we see a lot of innovation and a lot of successes as well. So based on our learnings throughout the year, each year, we engage our team in narrowing down what we believe to be the top 10 contemporary topics where we can share our thoughts to help pharmacy leaders focus on advancing important core strategies with confidence and with success. So it can help them focus on top priorities. It can also help them avoid chasing shiny objects as well in some circumstances. So I think lastly, we understand that pharmacy leaders face a lot of adversity when advocating for resources, and they need to drive resources that they need to drive innovative change that will help the organization reach its goals. So we try to reach a broad audience with our messaging and cascade the top 10 in a variety of ways throughout the year to help share an uplifting vision for the future of pharmacy and the need for health systems to invest in a meaningful way in their pharmacy programs for success.
There really is a ton of great information packed into the 2025 top 10, way more than we could get to in the time we have for this podcast. But, I wanted to delve into a few of the top 10 items that really caught my eye. And in terms of framing the issues around the top 10, why is 2025 such a pivotal year for pharmacy strategy in health systems?
Well, Jim, I think, from at least my vantage point and at least the lens over the last 6 months, we've been seeing more and more executives asking not only their pharmacy leaders, but even Visante, how could pharmacy services play a bigger role in strategy related to health system performance? And one thing we know, especially over the last month or so, we won't get into politics here on this podcast, but there's changes happening in the environment. There'll be changes in the healthcare marketplace. Some of those changes are going to be positive for pharmacy. Some are going to maybe have a little bit of headwinds pushing back. And I think it's going to be extremely important to be adaptable to change and being able to focus and prioritize, pharmacy strategy within the organization to drive better outcomes, financial performance, safety, quality, and all the things that lead to better patient care. Some of the things that I see in trends for 2025, I think we're going to continue to see pharmacists integration within care teams, role expansion of pharmacists, especially in the ambulatory space, chronic care, chronic disease management, medication therapy management, patient safety. I think this is an area where, we're going to see more prescriptive authority. Pharmacists, playing that larger role. I think that's going to be a huge opportunity for positive change within the profession and obviously for the patients that our health systems serve. I also think we'll see, more and more value-based care. Value-based care has been talked about for the last 10 years, but when you look at the amount of innovation happening on cell and gene therapy, biologics, and all of those high-cost drugs, the role pharmacists are going to play in being able to manage not only the cost of those medications, but the appropriateness and achieving the outcomes for patients, for payers, is going to be critical. I do still believe we will see new opportunities for ambulatory revenue generation within pharmacy. Obviously, specialty pharmacy and health system specialty pharmacy has been growing over the last 5 years. Infusion strategy is also really, really important, and many health systems are working now to determine how best to position themselves to be able to service their patients, make sure that they have access points for their patients in a variety of different care settings. Direct to employer services. We continue to see innovative health systems looking to say, how can we work in our communities to make our communities healthier, and how can pharmacy play a role in that? There will need to be cost control measures put in place, obviously. It's a continual thing that our profession has worked on, especially in our acute care environment, and how do we manage costs, utilizing generics, biosimilars, optimizing formularies. All of those things are going to be extremely important here in 2025, and that's why I believe 2025 is really going to be a pivotal year for health systems to invest in pharmacy strategy.
And Phil, I think you listed off so many important things. I mean, I don't think there's ever been a better time, a better opportunity than right now to be a pharmacy leader, to be in pharmacy. I think the future is very, very bright. And I think every year is a pivotal year. If you're a leader and you don't look at every year as a pivotal year, maybe you want to start sharpening your resume because the organization expects that from its leaders. But what great opportunity right now to drive value through pharmacy.
Yeah.
Regarding strategy, you guys highlight the use of smart care, where I think you emphasize components like safety and medication management, access, regulatory compliance, and other things. Explain this approach and why you think this is really important.
Yeah, being pharmacists, we've always loved acronyms, right? Smart care. But I think it's a great one. And it's always amazed me that while we all know, and the literature undeniably supports, that a well-run resource pharmacy enterprise helps contribute to every single strategic priority and goal of every health system in the country, and better care and better outcomes for patients and the organization. Like, most pharmacy leaders are still not maximally effective at communicating this value to senior executives in a manner that sticks and makes an impact and results in the support and the resources needed to thrive and drive value. Jim, we've both made our careers out of successfully building business cases that succinctly articulate the value of investing in pharmacy in terms of both financial and broad organizational goals: quality, safety, efficiency. It's not just about the money. But as a CPO, I was always able to get resources when I could successfully flip the conversation from looking at pharmacy as a cost center to a strategic asset or value center or the organization. So in recent years, one constructive criticism I sometimes hear of pharmacy executives is, with all the focus on 340B and specialty pharmacy, sometimes they get too focused on dollars and not enough focus on contributing to the overall goals and mission of the organization. And if they focus only on dollars, that can help create jealousy in the ranks of other executives and peers in the organization that don't control budgets that are as large as the pharmacy leader's budget. So in the field, we often see that pharmacy leaders sometimes get too detailed, they get too granular with their messaging, and oftentimes the more simple they can be, simplicity is better. So this year we strive to develop a simple acronym that leaders could hopefully remember and relate to, with hope that would help them tailor and simplify their messaging around all of the many financial and non-financial benefits of investing in their pharmacy program, thus smart care. Financial performance, I think, is still currently the top goal of most health systems. And while savings and revenues often carry the day in financial performance, being able to clearly articulate all the other ways that pharmacists contribute to better quality, safety, compliance, and access, as well as provider and patient efficiency and satisfaction. If you can articulate those values on top of the dollars, that can make really good business cases really great and enhance the lens through which the leader across the organization view the pharmacy program. And lastly, I think, maybe not every element of smart care will resonate and be a top priority for every organization every year. So as a leader, you need to be in tune with what's hot in your organization in terms of priorities in the current year you're in, and message effectively to those priorities. So knowing which aspects of smart care are the most important to your organization this year and in future years is going to help you focus your messaging to what's most likely to be successful to drive value and gain resources and grow the pharmacy enterprise.
Yeah, you do highlight the pharmacy executive in several of the top 10 areas. Expand a little bit on your thoughts regarding the role of the pharmacy executive in really driving organizational success.
Yeah, and from my perspective, I think, we're seeing more and more organizations elevate the role of the pharmacy executive. I think, over the years, we've seen continued evolution of the role of the pharmacy executive. We're seeing pharmacy executives today that are in chief pharmacy officer roles, VPs, senior VPs, executive vice presidents. And we're seeing pharmacy executives actually step outside of pharmacy and taking broader leadership roles that assist with the priorities and focuses of the organization. I think, one of the things that I think we're all challenged with, especially in the highly dynamic environment that we're in today, is that there are 1,000 priorities in organizations. And with a pharmacy executive, I think it's incredibly important to be able to not only set the vision, but connect the purpose, those priorities, and then become laser focused on the ability to execute on them. We oftentimes see, pharmacy departments and leaders have 50, 100 different things that they look to accomplish in a year. And that can be extremely challenging, especially with the number of different, departmental initiatives that span beyond pharmacy. And, the ability to work and collaborate across different departments and with medical staff, nursing, and even departments such as finance and IT. So I think it's going to be incredibly important in driving organizational success that pharmacy's goals and strategies are, as Steve mentioned, aligned with the organizational goals and strategies. And where we see a lot of success, and we're seeing more and more of this, we're seeing pharmacy as some of the strategic pillar within an organization and actually outlining 2, 3 different core goals that span the top of the organization, which really means, one, those are things that an organization can push forward on that actually improve financial value, clinical outcomes, care, safety. And so I think it's really important for our pharmacy executives throughout the country to be nimble, be bold, help focus and set priorities for their teams, and then really, work to connect to purpose with team members, motivating them to be able to achieve and execute on those goals.
Picking up on that a bit more, what do you guys think are some of the key competencies that pharmacy leaders are going to need to be successful in 2025?
Yeah, there's a lot of things that come to mind with what you need to do to be successful. In fact, there's books written on it, right? So, I'll share some of the top things I think. Phil mentioned maybe this past year we've seen more pharmacy executives get promoted in the C-suite and outside of pharmacy than we've ever seen in our careers, which is great, right? We're doing something right. And I guess if you're going to get promoted, you better have a great succession plan behind you of people who can lead. Don't forget about that. But I think, and actually having a really good network can help with that. Like the more networked you are, you're always should be recruiting, always be trying to meet motivated leaders on a national level that you can bring into your organization as you grow in success. So I think having a succession plan and maintaining a strong network and being active and engaged in the profession are 2 immediate things that come to mind. Some of the old standbys, I think now is no different than historically politics. Like you need to, there's no more brutal political organization than a hospital, especially if you work in an academic medical center. So understanding the organization's politics, the flow of dollars, and most organizations usually, while there's a lot of VPs and executives, have 2 or 3 people that are most influential that really drive the big decisions. So studying the organization, knowing who those 2 to 3 most influential leaders are in the politics that they're involved in, and build alliances with those 2 to 3 is really important. And that leads me to relationships, right? Develop meaningful, take the time. You should spend 5 to 10% of your time as a pharmacy executive developing strong relationships with formal and informal leaders across the organization, be an expert collaborator, and find ways to help others win. That can always come back to help you. And don't forget about the dollars, right? Having pharmacy is high cost and it's high revenue and it's high entrepreneurial opportunity. So having strong financial acumen and mastery of healthcare financial complexities and being able to clearly understand and articulate the pharmacy budget and how it contributes to the overall organization's success is a great way to get ahead. It's a great way to be successful. You also don't want to make the mistake of not understanding the budget and miscommunicating terms to your CFO. That can backfire. And I think just a couple other thoughts. One is, with relationships and networking, a lot of that boils down to strong communication skills. So you have to be able to effectively articulate pharmacy's value proposition and align it with organizational goals without any fluff in that messaging and without being perceived as being boastful. So this includes articulating, clearly communicating pharmacy's financial results to the CFO, be clear and concise when you do that, being able to message about what's best for the organization, not what's best for pharmacy, and always tie messaging back to what pharmacy can do to help the organization and others in the organization be successful, not just what makes pharmacy successful. Don't just wave the pharmacy flag, for example. And we've heard in the past the importance of, pharmacy leaders have a great opportunity because they're bilingual in terms of being able to communicate both on a patient-centric side and a business-centric side, and making sure you're not just focused on the business, but you also remember you're in the patient business and communicate your value to colleagues and to your team in that manner. And lastly, Phil kind of ended with, don't forget about your team. So being good and spending, 5% of your time rallying the troops, walking around, knowing people's names, communicating frequently about your department and your organization's vision, your purpose, your value, your goals, and being the face of those values and vision and doing so with optimism. So spend as much time as you can being positive, connecting to the values, and expressing gratitude to your team and say thank you every chance you get to your team members. Those are some things that come to mind that leaders should be focusing on in 2025.
Shifting gears a little, you highlight technology as an important strategy element. How are emerging technologies really transforming pharmacy practices? And maybe what are some examples of successful tech integration that you guys are seeing in some of the leading health systems?
Well, Jim, I think we could probably do a whole 2-hour podcast on technologies. The reality is there's a lot of movement in the medication use and pharmacy space. There's a lot of really unique technologies that are coming to market. I think, obviously we're seeing a lot of buzz around artificial intelligence, AI, and we're seeing it in our daily lives. If you're upgrading your smartphones, you're getting new AI features. So we're going to continue to see that evolution within health systems. I think, there's a lot of great opportunities that actually will improve efficiency. Some of the frustrating tasks that pharmacists and pharmacy technicians have to deal with on a daily basis that are repetitive, high stress. I think there's some significant opportunity where AI can play a role there. I do think, when you see, technology that's happening in the marketplace outside of health systems usually are lagging behind. So I don't know exactly, from my perspective, how much we'll see. We see some innovative health systems implementing, prior authorization, AI technologies, different machine learning, the big EHRs implementing AI and finding ways to pilot and bring some of those things to fruition. But I think over the course of this year, we're going to see a real fast pace on the role AI plays within health systems and pharmacy. From an automation perspective, many pharmacies around the country are pretty highly automated today. I think we're going to continue to see more and more of that. Robotics, we see organizations that are looking for ways to use robotics within consolidated service centers, using robotics to transport, medications, across, their facilities. And so we will continue to see more and more of this, enhancing accuracy, speed, and being able to reduce human errors. And I think the last thing from a technology perspective is really around analytics. Most organizations struggle with big data. There's so much data within EHRs and within pharmacy, and the ability to manage populations and move towards value-based care is going to continue to require your ability to understand the data, set those goals and targets, and then be able to drive outcomes associated with it. So, pharmacy departments partnering, with analytics teams and making sure that's part of the priorities of the organization. We're going to see, I believe, more and more of that here in 2025.
Yeah, I think that's a really important point. I mean, the volume, variety, and velocity of data just continues to expand exponentially for sure. For 2025, hospital margins again continue to be challenged. And you guys emphasize the importance of revenue and entrepreneurship and the concept of turning costs into assets. You touched briefly on a couple of areas, but where do you see the biggest opportunities in pharmacy to actually accomplish this?
Sure. Turning costs, as you mentioned, from being viewed as a threat to an opportunity, it's an essential skill for all successful pharmacy leaders to have. And I think, the Smart Care article you referenced earlier, that article provides a lot of ideas that leaders can leverage to fit best with their organizations. But in my opinion, some of the things you asked about, let's take gene and cell therapies, for example. It's a sexy and important topic, no doubt. And pharmacy, clearly has a lot to offer in this area, especially in the future. In 2025, though, this year, in most organizations, I haven't seen a lot of tangible things that are going on that pharmacy is latching on to have it be an immediate value driver in that space. So while we clearly recommend, working to identify what cell or gene therapies your organization provides and how pharmacists can be more involved, this isn't going to provide a significant short-term bang for the buck for the organization. So it's important to keep on your radar, but maybe not be your top priority. Let's take biosimilars and GLP-1s too. Both of those, they lack in terms of big impact financially that compared to relative to if you're focusing on internal specialty pharmacy or growing your ambulatory infusion services. I think those two, specialty pharmacy and ambulatory infusion growth, still deliver more quantifiable both savings and revenue opportunity for the organization than some of the other areas, biosimilars, GLP-1s, and cell and gene therapy, especially if supported by robust pharmacy supply chain practices. So remember that, specialty medications, specialty pharmacy medications, what was hot 10 years ago, and a lot of organizations have gotten out of the gate with starting their programs, they currently occupy between 55 and 65% of our nation's annual drug spend. And at least that much, 55 to 65%, we continue to see that drugs leaking out of health systems that have internal specialty pharmacy programs. So most organizations still have work to do to try to turn around that significant business opportunity leakage and get that business into the program, and often in excess of $50+ million annually. If you look at specialty and ambulatory infusion programs combined, and additional gross margin they can add to the value if they focus on growing and accelerating the success of their internal programs. So I think it's still very, very most important that leaders continue to focus on efforts to analyze and understand where specialty and infusion leakage is happening, and how reducing this leakage and maximizing internal capture can help to improve financial and clinical outcomes for patients and overall goals and for the organization, and invest back in better patient care, better patient experience, and better provider experience. And, with all the challenges in healthcare these days, those two areas are areas where selecting the right outside partner can help bring speed to value and elevate your overall success as well.
Phil, earlier you mentioned a big area of effort for you in terms of revenue generation is infusion services, but I'm seeing really unprecedented growth and competition for that market. There's outside firms that are investing in both existing and new for-profit and standalone infusion centers. There's also a trend of increasing merger and acquisition activity with more vertical integration. And competitors really may enjoy advantages such as, better access to capital, improved workforce recruitment, agility in making operational changes, early adoption of technology and software innovations. And additionally, I think many of these competitors employ sales representatives who target prescribers for referrals. How can hospital-based infusion services be successful in the face of such stiff competition?
Yeah, Jim, when you look at health systems over the last 20 years, they've obviously, built HOPD locations. When you look at patient convenience and patient choice today is growing at a rapid rate. I think health systems over the last 20 years have said, if you build it, they come. We have prescribers and we can prescribe it and they get filled in a hospital outpatient department. And what we're seeing with not only this competition, but I think it's the right thing for health systems to be focused on is patient experience. And so when you look at convenience, access, and patient experience, these are obviously the drivers of, if you're a patient receiving infusion therapy, you want options. And so, health systems, over the last couple of years have been saying, we've got a fragmented infusion operation across hospitals, different locations. How do we start thinking about this holistically together? What sites of care are we offering our patients from a convenience perspective? Obviously, how do we control costs associated with that? Transparency around pricing. And I think all of these things are extremely important for health systems. If you look at, where we've seen quite a bit of movement is around, pharmacy-based infusion suites, looking at partnering around a coordinated effort with medication access, prior authorization, to be able to, one, make it convenient for patients, make it convenient for providers, nurses, and clinics. And when you look at the competition that's out there, there's a lot of holes that exist within the health system. And if you're a provider or a nurse or a medical assistant in a clinic, and you're saying, well, what do I do here? I've got a patient. You've got insurance companies that are saying where things should go. They're going to look for the easiest location to go to, and a team that takes that, prescription, coordinates with the patient, making that patient experience great. So there is a huge role for pharmacy to step up and rise to the occasion and help organizations strategically align their infusion services, offering, new sites of care, home infusion services, being able to provide different, therapies, whether it be in the home and the pharmacy-based infusion suite. And we're still seeing across the country, even, with the aging population and the amount of infused medications to treat, chronic diseases and sickness, we still see growth even in HOPD locations, primarily because there's access concerns. And so if you're a patient that is newly diagnosed and it takes you 45 days to get an infusion, you're going to be looking for anybody that can provide that. And so these outside competitors are coming in and making it easy for patients to receive therapy. So that's got to be a focus. Patient experience has got to be a focus. And then obviously focusing on quality. So there's a lot of opportunities to focus on quality in that care coordination, especially with an integrated EHR. And so the role that pharmacy can play in this, in 2025, we're seeing more and more organizations placing focus in this area.
And Phil, this is just, we've talked about this before. This is just like specialty pharmacy was 7 years ago, where there were a lot of pharmacy leaders saying, well, woe is me. There's large specialty pharmacy. It's too late for me to get into that marketplace. Well, I think we've proven that wrong, right? There's a lot of people the past 5 years that have started internal specialty pharmacy programs, and those programs are keeping the organization afloat financially. Most hospitals and health systems today have not invested in the alternate sites of care that Phil mentioned. They still rely on their legacy HOPD infusion sites of care. So the pie keeps getting bigger each year with new drugs coming to market, new indications, And you got the easy button. You have access to the EMR. If you, as a health system, can make it easy for your providers to leverage your EMR to refer business internally to your program, they're going to love it, and patients going to love it, and all those other benefits Phil mentioned are going to be real. So it's a great opportunity, and don't fear that there's a lot of big competitors out there. Instead, figure out a way to be innovative and get the business internal. You can grow quickly.
A complementary area that you discuss is how alternative payment models, APMs, are really reshaping healthcare, shifting away from the legacy fee-for-service model to really value-based care that rewards quality, experience, and cost effectiveness over quantity. And health systems are really adapting to APMs by a variety of different mechanisms, but how should pharmacy leaders be positioning pharmacy services to best support this APM movement?
This article about alternative payment models really brings me back to pre-pandemic in the mid 2015 times, where it was a major focus for most organizations. And it is true that alternative payment models, Phil called them earlier, value-based payment models, that they're starting to reshape healthcare. In some markets more than others, it's not everywhere yet. But pharmacy leaders who understand this and have a clear vision for how pharmacy can positively impact organizational success in those models are going to have very, very bright futures. So my recommendations for pharmacy leaders in this area are severalfold. First, spend some time refamiliarizing yourself with the vast amount of literature that's out there demonstrating the very meaningful results and outcomes that can be achieved in terms of chronic disease outcomes, positive chronic disease management outcomes, by embedding pharmacists into primary care and specialty clinic models to care for complex patients. That can include patients with hypertension, hyperlipidemia, diabetes, asthma, CHF, etc. And it also can include a variety of specialty care complex diseases. And when you do that, results consistently are improved medication adherence. Patients are on the drugs, they're on the right drugs, they're off the wrong drugs, reduced polypharmacy, and thus you have better clinical outcomes. You're going to have fewer hospitalizations. A lot of articles represent up to 30% reductions in hospitalization rates when pharmacists are embedded into complex patient care models. You're going to have better physician capacity to focus on patients that most need their help. You're going to have better physician satisfaction. You're going to have better patient satisfaction. You're going to there's still a huge nursing workforce shortage. You're going to be able to help transition nurses into different roles and have a positive impact. And all those things, when they come together, lower the total cost of patient care. And I think so, in addition to the ambulatory patient care model, secondly, focus on embedding pharmacists and pharmacy technicians' roles into transitions of care at both hospital admission and hospital discharge. Pharmacists, we know a lot of med errors still happen due to communication problems when patients come in and out of different care settings. And pharmacists are great at identifying and resolving medication-related problems during transitions of care, ensuring the patients are on the right meds when hospitalized, on the right meds when they go home, and that they take their medications as intended post-hospitalization. And then I think also thinking about ways to expand your medication therapy management or MTM programs, your collaborative practice models, putting pharmacists in a position where they can partner with prescribers to prescribe after they get the diagnosis the high-cost, high-risk regimens and work patients to keep on those drugs and make sure they're effective after they start those therapies. That can have a 7 to 10-fold ROI by reducing hospitalization, ED visits, medication-related complications, etc. So, when I've always, in my past, thought about starting those complex care model practices, embedding pharmacists in transitions in care, and starting innovative MTM and the collaborative practice agreements, it always started for me with leveraging pharmacy resident power, leveraging pharmacy resident projects to help implement those models, and then making sure they're measuring the quality and financial impact of those models, and then putting together great decks that you can take throughout the organization and share the value across the organization of pharmacy being delivered in those alternative payment models. So I think the best and most advanced pharmacy leaders and pharmacy departments are continuing to put renewed emphasis on advancing the pharmacist role to impact alternative payment models. And it's a lot of fun doing so, and the value is just easy to quantify And it happens quickly when you put pharmacists having the right role in those care models. So it's a great opportunity for the future to think about.
Everything we've talked about is great, but it all takes skilled labor to execute. And healthcare leaders are again citing workforce shortages as one of their most pressing concerns. And you guys note that the U.S. faces a projected shortage of 3.2 million lower wage healthcare workers by 2028. And that includes pharmacy technicians. And technicians are particularly affected, with 88% of pharmacies and 74% of hospitals reporting shortages. And critical shortages of pharmacists are also emerging, with 60% of hospitals reporting gaps in frontline pharmacist roles and 57% struggling to fill managerial positions. So what should pharmacy leaders be thinking about in terms of workforce strategies and solutions?
Well, Jim, I think, the hardest thing, and going back to the beginning of this podcast, is health systems today have so many priorities, and it's extremely hard to focus in areas of workforce strategies and solutions. Organizations and health systems, they're going to continue to see challenges in this space. I think from a recruitment and retention perspective, it's going to be really important to, seek new ways, think outside of the box. An organization will have core strategies and how, you use rewards and recognition and a variety of things that are set by, the talent teams and HR within organizations. But as you look at a younger workforce, it's going to be really important to make sure that folks are involved in the decisions that affect their work, the ability to communicate and over communicate and collaborate. Providing collaboration and teamwork for team members is going to be extremely important. I think the other pieces that we're seeing is around workforce flexibility. And so, during COVID, we had a number of folks that were able to work from alternate locations from home. And obviously, we have care being provided 24/7, 365 in health systems today. But when we look at care models and flexibility in those care models, I think, organizations are going to have to look to new strategies to accomplish the goals of being able to provide clinical care, what care has to be provided in person, what care can be provided remotely. And I think that's going to be a tremendous need for organizations, pharmacy leaders to put focus in here in 2025. I do believe, mentorship development, leadership development, those are all going to be important pieces. Structured approach, Steve had mentioned earlier, on succession planning, especially with the younger workforce, they're looking for ways on how their careers can grow and elevate quickly. Some may say a little too quick, but the reality is that they're looking for opportunities, and they need to see, a vision of where they are today and where they're going to be in the future. And for pharmacy leaders, it's going to be incredibly important to be able to make sure that you're connecting with teams, collaborating with them, making sure they're involved in the decisions that affect their day-to-day work, help them develop solutions and facilitate solutions that can, break down the frustrations that they deal with on a day-to-day basis. So there's no silver bullet here for workforce strategies that's going to solve the problem. But I do think there is some innovative ways to make sure you're connecting with teams and making sure that obviously we are in the people business. We're caring for patients each and every day. And in order to do that, your employees not only have to be satisfied, but they have to operate at the top of their game. And so out of your 15 priorities, 20 priorities for a health system, pharmacy, this has got to be up there towards the top. It's easy to let it slide and say, oh, we're doing a few initiatives here or there, but this has got to be constant, repeatable, and part of leader standard work on a day-to-day basis.
And Jim, you use the phrase critical shortage when you asked your question of pharmacists and technicians. And when I think of critical shortages, I think of crisis. And when I think of crisis, like there's opportunity, right? Never let a crisis go to waste. So I want to mention two things. Pharmacy technicians. We are still in a critical situation with recruiting and retaining qualified pharmacy technicians. And I can tell you what we pay technicians is still an abysmal. It is a big problem nationally. Sure, sometimes leaders get $1 an hour wage increases and celebrate, but when you look at like how much more expensive it's become to live in general over the last 5 years, I still see HR leaders hiring outside consultants to help them determine what they should pay workforces in hospitals and health systems. And I've never seen an outside consultant come in and say, you're underpaying your pharmacy technicians. But the reality is 99% of organizations are. And so Phil mentioned being bold earlier. I think this is the time for leaders to be bold and put together technician career ladders, meet with HR, put together business case around how meaningful pay increases for the technician workforce is going to drive better retention of technicians. We know turnover is important. Technicians make an error, it kills a patient, right? Technicians today can go work at Home Depot in a call center as a Walmart greeter and make more money with better hours, less stress, less risk than they can being pharmacy technicians. So as a profession, we need to continue to be bold and recognize that we got to increase the professionalism of pharmacy technicians, compensate them what they're worth, and be bold in advocating for that internally. And in terms of that's going to help your pharmacist workforce be better retained and higher quality as well and get closer to the patient, because we all know that pharmacists can't take care of patients in a patient care role in a clinical manner if drugs aren't getting to patients on time. So having a great technician workforces helps your pharmacists thrive, helps them be retained, results in better patient outcomes, keeps drug costs down, all the great things pharmacists do, right? It starts with having great technicians. And then you can look at your pharmacy practice model. We still see a lot of clinical practice models where there's a divide between the dispensing pharmacist and the pharmacist on patient care service roles. And seeing better integration of those roles is a great way to expand your pharmacist workforce, be an employer of choice, and again, just have a better place for all providers and patients to participate in the healthcare system.
Very well said. You know, I could probably keep going on this all day, but unfortunately we are at time. Guys, excellent session and great information. Thank you for taking some time to join the podcast, and thank you for all the work you do at Visante to support and advance the profession of pharmacy. You know, and for our audience, if you haven't read the full top 10 yet, check it out on the Visante website. And thanks again, everyone, for listening.
Thank you.
Thanks, Jim.